The Budwig Center, in association with Biomedic Clinic in southern Spain, offers the most comprehensive and advanced therapies and remedies using a total natural and holistic approach to disease. Our team of doctors, therapists, and medical support staff are on hand to ensure the highest level of comfort and care during the entire 2-week treatment program. Family and friends are welcome to accompany the patient during the therapies and can stay in our fully equipped apartments right next door. Patients that come to the Budwig Center discover the same thing that Dr. Wilner, a medical doctor of 40 years experience, stated in his book, The Cancer Answer. Dr. Wilner said, "When I heard about Dr. Budwig's cancer protocol, I too was very skeptical until I tried it. Numerous independent clinical studies published in major medical journals worldwide confirmed Dr. Budwig's findings that essential fatty acids were at the core of the answer to the cancer problem." Now, when you come to the Budwig Center, we make sure that you learn how to make the flaxseed oil and cottage cheese mixture exactly the same way as Dr. Budwig did. Dr. Lopez of the Biomedic Clinic conducts a consultation with each patient to review their history and condition before any therapies are administered. Hyperthermia was also favored by Dr. Budwig, and in clinical trials, 83.7% of patients experienced some reduction in tumor size using hyperthermia. A key advantage at the Budwig Center is our personalized approach. The first thing we do is a total body scan using the Vega Expert testing equipment from Germany. Vega is a diagnostic system that uses biological resonance. Our equipment will verify all the major organs as well as check for heavy metals, infections, hormonal imbalance, parasites, viruses, as well as it will evaluate your emotional state of health, which could be a major contributing cause to the illness.
The Vega test device is a non-invasive screening system that allows us to see exactly what condition the person is in, their health condition. We can also see the degree of development of any condition and choose the most effective treatment for each individual patient.
The Vega test will also recommend which remedies are needed, and the Budwig Center has an ample selection of pure natural remedies, and if necessary, we can also refer you to a holistic biological dentist just 5 minutes from our center. Another very effective therapy we use is the Royal Rife frequency generator. Way back in 1938, the San Diego Evening Tribune made this announcement about Dr. Rife. The Rife's energy medicine successfully destroyed microbes associated with cancer and other diseases. Everyone that comes to the Budwig Center receives their own Rife Time machine to use daily in their homes. The Papimi device creates a pulsed electromagnetic field which is applied to different parts of the body, may help stimulate and activate the normal healing process and the growth and repair of tissue. But before any true healing can take place, in most cases you need to first clean house, and that is why a colonic irrigation is also part of our protocol, which helps to clean up the toxins present in the intestines. The therapeutic healing blanket, it took many years of research in the bioresonance field. We have our patients wrap themselves daily in this special blanket, and many report a reduction in pain and a general sense of well-being. For severe pain, in addition to various natural remedies, we have the Pain Master, which can reduce and even eliminate the severest of pains. IV infusions of glutathione and other homeopathic formulas to drain the liver, the lymph system, and kidneys, and enhance the immune system are also a part of the program. Seminars and group discussions on healthy living, cooking, herbal supplements, and lifestyle changes are an integral part of our program. We try to make it as easy as possible for all our patients that come by providing lodging right next door to our center. There are fully equipped 2, 3, and 4 bedroom apartments for our patients and guests.
I'm interested in trying to understand how pancreatic cancer grows and develops, and so I'm interested in trying to find novel molecular targets like various proteins or enzymes that we can target to make drugs against. And so I'm interested basically in validating novel drug targets for therapeutics in pancreatic cancer. Okay. So the pancreas is an organ in the digestive system. It has 2 major functions. It makes digestive enzymes to break down various foods that you eat, as well as it makes insulin, hormone that help control blood sugar levels. And so those are the 2 main functions of the pancreas. And so the pancreas is made up of different cells, and all of those cells can potentially become bad over time and become cancerous. The specific cells type that I study in the pancreas are cells that align the pancreatic duct. So there's a duct in the pancreas where digestive juices get dumped into to aid in digestion. Well, cells that line that duct can become cancerous and lead to ductal adenocarcinoma of the pancreas. And so I basically study that particular type of pancreatic cancer. And again, the idea is to try to find novel drug targets that drugs can be made against to hopefully better treat that particular cancer. So pancreatic cancer is the 4th most common cause of cancer deaths in the U.S. It's believed about 45,000 people will come down with that cancer this year. Of that 45,000, about 38,000 will die, so a very high mortality rate. The problem with pancreatic cancer is that we can't detect it early enough. And so unfortunately for many patients, when they get diagnosed with pancreatic cancer, it's already metastasized to other parts of their body. And it's the metastasis that unfortunately kills the patient. And so the idea is if we can try to find better ways to diagnose it early, then that should hopefully help with being able to better treat pancreatic cancer patients. Another issue we have with pancreatic cancer is treatments. For surgery, only about 10% of all pancreatic cancer patients are eligible for surgery. And even then, that still doesn't guarantee survival, long-term survival. Chemotherapy, many of the chemotherapies we use, the pancreatic cancer becomes resistant to it over time. And radiation is usually resistant to radiation. And so at the end of the day, we don't really do a good job when it comes to treating pancreatic cancer. And so the goal for me and many other researchers in this field is to try to, 1, find ways to better diagnose it early, and 2, find better treatments for it. So that's believed to be 2 causes when it comes to cancer. That's believed to be a genetic component and or an environmental component. So as it relates to pancreatic cancer, in terms of the environment, smoking is one of the major risk factors for pancreatic cancer, as well as chronic pancreatitis, long-standing diabetes. Alcohol there's not a strong association, but there has been some suggestion that alcohol potentially could cause some issues as well. So there's various environmental risk factors that can lead to various cancers, such as pancreatic cancer. There's also believed to be a genetic component, where basically you can develop a mutation in one or more of your genes in your cells that are responsible for controlling cell growth. So there's various genes that are involved in the development of pancreatic cancer. One of the main ones that scientists have discovered is a gene called KRAS. KRAS is a proto-oncogene, which means a gene involved in normal cell growth, but when it's mutated, it can become an oncogene. And again, it's mutated almost 90% of all pancreatic cancers. So almost all pancreatic cancers have this mutation in this gene. And so that suggests that mutation may contribute to the development and tumor maintenance of cells that can lead to cancer. And the challenge with RAS is that there are many different types of RAS. There's KRAS, which is the one I'm specifically focusing on because that's the one that seems to be most prevalent in cancers. RAS has been studied for many years, about 30 plus years, and we haven't been successful with making an anti-RAS drug in the clinic. And so the idea is, well, if we can't target KRAS specifically, maybe we can target a protein or a gene downstream of RAS. And that leads me to my particular protein of interest called PIM kinases. There's a family of these kinases. There's PIM1, PIM2, and PIM3. And they're oncogenes, just like RAS, so they're involved in cell growth. And they're also involved in inhibition of cell death, apoptosis. So they're oncogenes needed for cell growth, but they're anti-apoptotic, so they prevent cell death. And it's believed that these genes may be involved in contributing to some types of cancers, such as pancreatic cancer. And so in my laboratory, we're trying to validate these kinases, these PIM kinases, as possible drug targets in pancreatic cancer. Now, pancreatic cancer is resistant to radiation. That's what makes it really tough to treat, and is also very resistant to chemotherapy. And so previous studies in the literature has showed that PIM kinases in other cancers was responsible for radio resistance, being resistant to radiation treatment, and being resistant to chemotherapy, chemoresistance. And so we wanted to see if we were able to inhibit the activity or expression of PIMs, would that make pancreatic cancer more sensitive to radiation as well as chemotherapy. And we were able to show that when we modulated PIM expression through genetic means, as I mentioned earlier, or by using a chemical inhibitor against the PIMs to shut down its kinase activity, we were able to make the cells more sensitive to radiation exposure as well as to chemotherapy treatment, suggesting that potentially in the future, PIM kinases inhibitors in combination with other drugs or with other treatment modalities may serve as a better way to treat pancreatic cancer patients. One of the things that I'm excited about is here's this target I'm studying called PIM kinases. Various pharmaceutical companies in which I collaborate with have 2 actual PIM kinase inhibitors in phase 1 clinical trials now. So they're being tested, I think, on leukemia patients. And so I'm excited because, again, I'm hopefully involved in adding to the body of knowledge that may one day help treat various patients with different types of cancers, including pancreatic cancer. So that's what gets me excited, being able to try to figure out what's going on and validate these PIM kinases as possible drug targets. And then to know that pharmaceutical companies are actually pushing these drugs through the clinic to hopefully get them to patients is really humbling and exciting feeling.